A few months ago, a man sat across from me in my exam room and told me his 10-year-old lab had just been sleeping more lately, eating a little slower, maybe favoring one back leg some mornings. He assumed it was simply old age, the same way we assume our own knees will ache a bit more every year. By the time we ran blood work and imaging, the cancer had already spread past the point where we had good options left, and he asked me the question I hear more than almost any other in this job: could we have caught this sooner? The honest answer, more often than I wish it were, is yes. Not always. Cancer is unpredictable, and even the most attentive owner can miss something, but the majority of the dogs I diagnosed late were showing quiet signals for weeks or months before anyone connected the dots, because those signals look almost exactly like normal aging, or a bad night's sleep, or a dog just being a little off that day. If you saw the thumbnail of this video, you already know we're talking about the word every pet parent dreads. Hi everyone, I'm Dr. Nick Lane, your neighborhood veterinarian, and welcome back to the channel. I am not making this video to scare you, I'm making it because the earlier we catch this, the more options your dog has, and most owners have simply never been shown what to actually look for. Today I am going through the real warning signs that show up long before a dog seems seriously sick. The 2-minute head-to-tail check you can do at home once a month, exactly how to feel a normal lymph node versus a concerning one, and what genuinely warrants an urgent vet visit versus what you can reasonably monitor for a few days first. Grab a notebook, because I want you checking your own dog while you watch this. Let's start with the single most common one, lumps and bumps. Most lumps on a dog are completely benign. Fatty tumors are incredibly common and almost always harmless, but the ones that concern me are lumps that grow quickly, feel firm or fixed in place rather than soft and mobile under the skin, or seem to bother your dog when touched. Any new lump deserves a vet visit within a couple weeks, not because most of them are dangerous, but because the ones that are dangerous are only dangerous if we wait. Second, unexplained weight loss. If your dog is eating normally and dropping weight anyway, that is one of the earliest and most reliable signals. Something metabolic is going on, cancer included, because tumors are metabolically demanding and essentially compete with the rest of the body for energy. Third, changes in appetite in either direction, a dog eating noticeably less, or strangely, a dog suddenly ravenous who is still losing weight, both are worth mentioning to your vet. Fourth, a persistent dry cough, especially in an older dog who has never had breathing issues before. Most coughs are nothing serious, but a cough that lingers for more than 2 weeks, especially paired with fatigue, can point towards something growing near the heart or lungs. And this is one people dismiss the longest because dogs cough for all kinds of harmless reasons. Fifth, changes in bathroom habits, straining, more frequent urination, blood in urine or stool, or noticeable difficulty finishing a bowel movement. These get blamed on diet changes constantly, and often that's exactly what it is. But if it persists past a few days, it needs an actual look. Sixth, lethargy that doesn't match their age or activity level. A dog who is suddenly less interested in walks, sleeps through things that used to excite them, or seems to tire halfway through a walk they used to finish easily. This is the one owners misread the most because it happens gradually and we adjust our expectations right alongside our dog without noticing. Seventh, sores or wounds that don't heal within 1 to 2 weeks, especially with no obvious injury that caused them. Healthy tissue heals, abnormal tissue often doesn't, and a sore that keeps reopening or never quite closes is one of the more reliable red flags on this entire list. Eighth, and this is the one I want you to actually learn to check tonight, swollen lymph nodes. Dogs have lymph nodes you can feel under the jaw, in front of the shoulders, behind the knees, and in the groin area. And in a healthy dog, they're small, roughly pea to grape-sized, soft, and you genuinely have to search for them. Gently run 2 fingers along the underside of your dog's jaw, where it meets the neck, and behind the back knees where the leg folds. If you feel something firm, round, and notably larger than a pea, particularly if it's present in more than one location, that is one of the more specific signs of lymphoma, one of the most common cancers in dogs, and it deserves a same-week vet visit, not a wait-and-see approach. Ninth, an unusual or persistent odor from the mouth, ears, or any part of the body that isn't explained by normal dental issues, especially paired with any of the other signs on this list. And 10th, lameness or limping that doesn't resolve with rest, especially in large or giant breed dogs, since bone cancer specifically tends to target the growth plates of long bones in bigger dogs, and often first shows up as a limp people assume is arthritis or a minor sprain. Now here's the check I promised you, and I want you doing this once a month. It takes about 2 minutes. Start at the head and run your hands slowly down your dog's body the same way every time. so you build a mental map of what's normal for them specifically, since every dog has some harmless bumps, and knowing your dog's baseline is what lets you notice a genuinely new one. Feel under the jaw and down the neck for those lymph nodes. Run your hands along the ribs and belly, feeling for any new lump. Check in front of the shoulders and behind the knees, and take 30 seconds to just watch them walk across the room, checking for any hitch in their stride. If anything feels different from last month, that's your cue to call your vet, not necessarily to panic. I want to be very clear about something before we go further. The majority of individual signs on this list, on their own, turn out to be something completely benign: a fatty lump, a stomach bug, a strained muscle, an off day. This video is not meant to send you into a panic over every twitch and cough. It's meant to replace vague worry with an actual checklist, because vague worry makes people wait, and a checklist makes people act. The dogs I see with the best outcomes are almost never the ones whose owners panicked. They're the ones whose owners noticed something small, mentioned it at a regular checkup, or called in about it specifically, and caught it while it was still just one item on this list instead of 5. Age matters here too. Dogs over 7 are statistically at meaningfully higher risk, and certain breeds, boxers, golden retrievers, Bernese mountain dogs, and other larger breeds, carry higher genetic risk and benefit from more frequent wellness visits as they age, sometimes twice a year instead of once, specifically so blood work can catch changes before any visible sign shows up at all. If your dog checks any of those boxes, this is worth a real conversation with your vet about a slightly more proactive screening schedule, not because something is wrong, but because catching this early is genuinely the single biggest factor in the outcome. Let's bring this together into one simple habit. Once a month, run the 2-minute head-to-tail check, feeling the jaw, neck, ribs, belly, shoulders, and behind the knees while watching how they move. Know what's normal for your specific dog so you can actually notice what's new. Any lump that's growing, firm, or new gets a vet visit within a couple weeks. Any lymph node that feels distinctly larger than a pea, especially in more than one spot, gets a same-week visit. And any combination of 2 or more signs from this list together is always worth a same-week call, even if each one alone seems minor. This isn't about living in fear of your dog's next symptom. It's about giving yourself the one thing every owner I've sat across from in that hard conversation wishes they'd had: a head start. If this video gave you a clearer picture of what to actually watch for, please hit that like button. It genuinely helps this kind of early detection advice reach more pet parents before they need it, not after. Make sure you're subscribed so you don't miss the next deep dive into your dog's health. And leave me a comment down below right now. I want to know, are you going to start the monthly check this week? And has your dog ever had a lump or bump checked out that turned out to be nothing? Because I want other owners to hear those stories too. I read every single comment and I love hearing from this community. Give your dog a gentle scratch behind the ears for Dr. Nick tonight. Stay safe. Always trust your instincts.